Good evening, all. I'm Dr. Sandhya. So, as a sister said, I work in Fernandez Madhapur. So, today we are going to talk about the nurturing the soul in the earliest years. We all know, earliest years means 0 to 5 years. So, which is most critical period of the child's development, which is very, very important for everyone to know about the first few years of life. Why it is very important? Why? Because in the first 5 years we have to give love, affection, care to the children, not only for their physical growth but also for their inner well-being, so that the child can be feel safe, secured and connected from very beginning of the life. So for that, what we have to do, how we have to nurture the child. So by letting them experience and explore the things around, surrounding by themselves, and also by giving them peace and joy, and by talking to them very softly and kindly, by listening to them very patiently. With normal children only we have to be very patient, and coming to the point, like with special children we have to give extra care. We have to be very, very patient, and we have to deal them very softly. So before going into the presentation, like as already Preeti sister said, that I have done my bachelor's of Ayurvedic medical surgery in Hyderabad, and my master's in disability studies in NIMH, which is located in Secunderabad, and I'm an RCI certified holder. So I'm certified in sensory integration too. So I have 8 years of experience. I worked in different locations, like I worked in Bangalore, and I worked in Hyderabad and Vijayawada. So Vijayawada is my native place. So I worked in Vijayawada. So after that, finally I came to Hyderabad and I'm working in Fernandez. I in Fernandez we have, I'll be dealing with 0 to 3 years of children, right from the birth to 3 years. So the power of early stimulation, like what did you understand? Like what is stimulation? Can anybody know what is exactly? When we are sad or tired, what we will do? Like we just activate our brain through different activities, right? So how we will do? For example, if we are sad, what we will do? We will just listen to good songs, or we'll play some music. In the same way, when the child is having some problem, we have to activate the brain through different neurodevelopmental channels, so that the to promote the positive growth and development of the child. So in this, I'm going to talk about the stimulation part, and development part, and the red flags you need to identify as early as possible, so that we can prevent the developmental delays. What is early intervention? Preeti sister said that I'm an early interventionist. I think many of you know the physiotherapist, occupational therapist, speech therapist, and early interventionist. Early intervention, I think you might be aware of early interventionist. Early interventionist deals with only 0 to 5 years, but in Fernandez it's still 3 years. So, intervention is nothing but we have to give the child a variety of opportunities to experience and to explore the things around himself. And also, we should give support to the family and parents and family during pregnancy and infancy and early childhood development. Here, if you see in this picture, at birth, 25% of brain development is completed, right? 70% of brain development is completed by the age of 0 to 1 years. And 85% of brain development is completed by the age of 1 to 3 years. So 90% of the brain is completed by the age of 3 to 5 years. So we know that earliest years means 0 to 5 years, which is very, very important in everybody's life. So why first 1,000 days matter? Why it is very important? Why? Because when we stimulate early as possible, we can see many developmental changes in the child. Nowadays, nowadays if you see parents in this busy generation, they are giving too much of screen time, and they are not at all interacting with the child, and they are not stimulating the child in a proper way. Like not for a like that could be any reason, but still because in this busy schedule we are not giving time to the child, right? So with proper interaction, with proper stimulation, definitely the child is going to achieve his goals in a right way. So the rapid growth and development, which I have already talked about, and the myelination. Myelination is like it's a myelin sheet which is covered the brain and spinal cord, which transfers the neuro. I'm just telling why it is very important. So myelination is it's neural signals transfer from one neuron to the other neuron, which is very fast in the early stages. And the plasticity of the brain, like the brain has a beautiful tendency to change its structure and function according to the external stimuli. So this is also very fast. Neuroplasticity is very good in the early stages. And the synaptic formation and synaptic pruning. Synaptic formation and synaptic pruning means, here if you see, at 36 weeks of gestation, you can see the synaptic formation. It is very, it is not that fast at 36 weeks of gestation. At the newborn also, if you see, it's not that actively formed. And by the age of 3 months, the baby starts holding the neck, the baby starts giving eye contact, and also this, you can see the synaptic formation over there. So at the age of 6 months and the age of 2 years, if you see, the synaptic formation is very active. So here you can easily see the synaptic formation. So when you are not stimulating at that stage, like at the age of 6 months, 2 years, when you are not interacting with the child, so synaptic formation is pruned away. If you see the later sites, that is synaptic pruning. So the neural connections are very weak. So what I want to say is, every individual, like every parent or caregiver, they have to stimulate at the right time to improve the child's development age appropriately, so that the milestones could be age appropriate. So synaptic formation, this is synaptic pruning. Yeah. When the child is said to be a whole child, can anybody say like what is whole child? We all know that parents, when the child is not able to hold his neck, or when the child is not able to walking, or when the child is not talking age appropriately, then they will say, okay, you take him to pediatrician, or you take him to so on so, because the child is not walking, the child is not running, the child is not climbing the stairs properly, the child is not speaking age appropriately, then only they realize the child is having some problem. But not only the physical development, and not only the speech and language development, there are other areas also which we have to look after. Those are physical, social, emotional, sensory, cognitive, and communication. If you go with physical, that is gross motor. Anybody from medical background, like any from any of you from medical background? You, ma'am? Homeopathy doctor. Okay, good. Any of you? No. So let me explain you like what is gross motor and fine motor. Gross motor means the larger muscles, the large movements we use our hands and legs for sitting, standing, running, climbing, like that. And fine motor we are using our tiny muscles, to grasp, to reach, and to hold the things properly. This is fine motor, which is very, very important. And the social emotional. Social means, nowadays, if you see, there are many cases of autistic cases where they are not responding to the name, they are not giving eye contact, they are not giving social smile, and they are just not waving hi, they are not using, saying bye or hi. Nowadays, if you see, the cases are increasing. So social and emotional, they are not interacting with other kids. The peer group interaction is not at all there. Why it is not that why it is not age appropriate, because the social emotional development is also delayed. So we have to take care of the social and emotional development. And sensory part means we are using our body senses, that is vision, hearing, touch, smell, taste. We are using the body senses to the external environment. So apart from that, vestibular and proprioception. Vestibular is nothing but the coordination and balancing part takes place by vestibular, and proprioception means body orientation, like body awareness. So if you see in autistic children, they would be having vestibular issues. Vestibular issues means they extremely jump, they extremely run, their energetic levels are super high. They don't have any fear. So those are all comes under vestibular issues. And proprioceptive, body awareness, how to hold the things in an appropriate way, like how much pressure we should apply when we are holding the thing, or when we are holding a water bottle, how much pressure we have to use it. So those are all comes under proprioception, right? And coming to the cognitive development, which is very very important for everyone, the how we have to think, how we have to problem solving thinking, and ability to understand, and learning new skill, these all comes under cognitive. Why? Because in a baby, if you see, immediately after birth, what she will do, she will start sucking thumb. Why she will do? Why? Because she is hunger, it's coming from inside, right? Okay, I'm hungry, so I'm sucking my thumb. So when mother is playing peekaboo, what she will do, she enjoys the peekaboo game. So she started recognizing mother's face. So this voluntarily, this comes from inside, we are not teaching anything. So this has to be developed in an age appropriate way. And coming to the communication part, expressive language and receptive language. Many people think that, okay, my child is not talking, my child is not using any words. My amma, he's not using amma, he's not using daddy. Why? Why is he not using? We are not only considering the expressive language. We have to consider the receptive language. Receptive language is the ability to understand. How are we understanding? Like, is he understanding the commands? Is he properly, like, when you say something, when you say some command, is he able to understand that? Or is he able to recognize the daily living things in the room? Like, this is fan, this is AC. When you're pointing something, is he looking at that? So those are all the receptive language, like ability to understand the things. And the expressive language means the ability to speak, like, talking. But nowadays, again, some misconception, like, parents say, my daughter or my son, he's saying rhymes. He's saying all the rhymes, he's talking, and he's using different kinds of words, like he's saying apple, banana, all the words and all. But that is not functional speech. Functional speech is the reciprocal communication. Means when you talk something, he has to reply. Either non-verbally or gestural communication, but he has to reply. That is functional communication. So we have to take care of both expressive and receptive language. And I don't want to go deep into the red flags. Why? Because the basic red flags I just want to explain. See, if you see, when the child is not rolling by the age of 4 months, or when the baby not holding the head, during pull to sit, or when the baby is not properly crawling at the time, not standing or not walking age appropriately, then these are the basic gross motor red flags. And coming to the fine motor, as I said before, that fine motor means we are just using our tiny muscles, like, reaching. Suppose if you keep a toy in front of him, he has to reach the object, right? Simply, he should not watch. He has to reach, and he has to grasp. If you give something to the baby, he has to grasp in a proper way, and he has to carry the objects. At the age of 1 month only, the baby starts using both hands, right? So he has to use his both hands bilaterally, which is very very important at the age of 1 month. So bilateral hand use is very very important. So these are all the basic patterns of hand skills. And these are the fine motor red flags. See, like when the baby is not reaching or not holding toys or not releasing the toys by the age of 6 months, or not able to move the toy from one hand to another hand, unable to pick up the small objects, and not holding the crayon or not holding the pencil by the age of 18 months. So these are all fine motor red flags. And coming to the language milestones, if you see, I just don't want to go much detail about the milestones and all, which are very, very important. See, by the age of 1 month, the baby startles. Startle. Suppose if you are making sound, the baby startle reflection, give a jerk kind of thing, and expressive language at the age of 1.5 month. So the baby can we can differentiate the cry, like like when she is crying for hunger, or when she is crying for pain, or when she is crying for when the diaper rash or something kind of thing. We can differentiate the cry. That is expressive language. And at the age of 4 months, quiets to voice and blink eyes to sound. And she can give the reciprocal exchange, like she can enjoy, she can start cooing sounds. Suppose if you're talking, the baby starts cooing, that kind of sounds the baby starts telling. So by the age of 4 to 9 months, the baby starts raising up the arm. When you come near to the baby starts raising her hands. That is receptive language. And the baby starts babbling by the age of 9 months. Mama, papa, papa, papa. These kind of babble sounds by the age of 9 months, the baby can start. And by the age of 12 months, the baby can point. Suppose if there is an object or the baby likes, so she starts pointing the object. So she has to point. Nowadays, if you see, there are many red flags in language. So she has to point, and she has to say bye bye, hi, and she has to give high five. At least 50% of intelligible words starts by the age of 18 months to 2 years. And coming to the 30 months, if you see, mm, starts in expressive language, the baby starts using sentences like it's two-word combinations and three-word combinations. So these are the basic red flags. When the child is not babbling by the age of 6 months, the baby is not giving gestural communication, when the baby is not able to recognize the sounds or not responding to the familiar words, and can't understand the simple request. So when the baby does not say meaningful words like mama, dada by the age of 18 months. So these are all language red flags. So these are the cognitive red flags. See, the baby has to enjoy the eye contact, cuddling, all these things. When the baby starts avoiding this eye contact, and when the baby is not giving proper eye contact and not at all interested in playing the games like peekaboo, or not enjoying when too many people are there in front of the baby, and when the baby not searching for the hidden objects and all, and when the baby is not sharing the things and not giving eye contact, not understanding the function of the common objects, like common objects in the sun. Mama, water bottle, there is a water bottle, go and get the water bottle, or go and get the ball. Is she understanding or not? That is also a big red flag. And not able to match the colors and all, these are all the red flags of cognitive development. And coming to the social and emotional red flags, if you see, the smile, when the baby is not giving proper smile, good social smile, or when the baby is having some avoiding stranger anxiety. Nowadays, if you see, many children, they don't have any stranger anxiety. They just come and they just play around. But that stranger anxiety is also one of the good sign, but which is not there nowadays. So no facial expression, like complete flat expressions. They are just giving the flat expressions, no expressions, nothing. So that is also one kind of red flag. And if someone new person is coming, they are not recognizing them, and they are not just looking at them, that is also the red flag. And nowadays, if you see, pretend play, which is very very important, like when mama is talking on phone, the baby also holds the phone and starts talking, right? That is pretend play. Or when mama is cooking, the baby also starts doing some pretend play, which is very very important. It starts by the age of 2 years, so that is also one red flag. And coming to the visual and auditory, see, when the baby is not giving eye contact and not able to the focus to the basic objects, and when the baby is not tracking the items in a proper way, and not responding to the loud sounds and not responding to the name call, those are also the red flags. And seeing the soul in every child, like to whom we have to give early intervention. For every child, early intervention is must and should. Why? Because if you see, there are environmental risk factors, like nowadays parents are not interacting much, as I said before. Because of that, they are not stimulating the child in a proper way. Because of that also, we are seeing many developmental delays in this like in this generation. We are seeing many developmental delays because of not poor parental interaction. And so that ideally every child requires early intervention. And all the NICU graduates, why all the NICU graduates require early intervention? Because in NICU, we have to, there could be many reasons why the child got admitted in NICU, but still we have to teach the developmental patterns. And we have to create a parental awareness, like how the child is going to become. So how the child is he or she is developing age appropriately or not, we have to create a parental awareness. So all the NICU graduates requires early intervention. And those the families who are having the developmental delays, those also requires the early intervention. So these are the main, like as an early interventionist in Fernandez, these are the developments we are looking after. Like the motor development, as I have told the red flags of all the developments, the motor part, the sensory part, and the cognition, social and emotion, speech and language, and communication. So I just want to show one video of my case, few cases. So her name is Pranaya and she is 2 years old. So she has been diagnosed as high risk of autism. So at the age of 2 years. So they are coming from the sessions since 6 months. If you see, once again, let me play the video. Yes. See, if you see, I just want to hide the face. I don't want to put the face. So here we are. Earlier, she doesn't recognize the colors. It's very difficult for her to understand the colors and all. So she would be not giving the proper eye contact. Not even responding to the name. Nothing was there. The mother was very much depressed at the time of start in the starting sessions. So she came for 5 to 6 months. She did many activities, and after all these activities, she has improved a lot. So if you see, these are the different activities what we do at our child development center. So she has toe walking. For toe walking, we used to give these kind of different activities to to get rid of that. So she doesn't jump. So for jumping, we used to give activities. So we conducted many home program activities, and we also conducted. See, if you see here, parents are also involved, right? So we always encourage parents to come inside and watch the session what we are doing inside. Why? Because nowadays in many child developmental centers, if you see, the parents, they won't allow the parent inside, right? But for 45 minutes we will work with the child, but the rest of the time the parents will be working with the child, right? So parents has to learn all the skills what they are going to do in the center. So this is very very important. This is completely different from Fernandez Child Development Center, is completely different from other child development center. Why? Because we allow all the parents to come inside, and we also conduct home program activities, and we conduct buddy sessions. Why? Because of poor socialization, we conduct buddy sessions and we will allow the parent inside. So this is the beautiful feedback of the parent after 5 to 6 months of sessions. If you see, you can read, or shall I read the feedback? Or this is the beautiful feedback. I felt so overwhelmed after this feedback. Why? Because the mother was very much depressed before the sessions, but after coming here, this is the feedback of the mother. So she has improved in many areas, and she started mingling with other kids. She started giving very good eye contact, and she started playing pretend play. All this has improved after taking sessions. Why? Why it has improved? Why? Because the session started at the right time. Like at the age of 2 years, we started the sessions. This is the same thing if we start after 3 years, definitely it will be very slow. And it is very difficult for the therapist and also very difficult for the parent. Why? Because as I said before, the importance of the stimulation at the right time. So they brought the child at the right time. So we are seeing many results at the right time.
Say hi.
So now
Hi,
she
ma'am.
started speaking, you can hear.
Blue color. Take blue color. Very good. Pranay, what is this? What is this? What is this? What is
Thank
this?
you very much.
What is this? What is this? What is this? 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 No, this is ox. What is this? Very good. ఇప్పుడు నీకు ప్రణయ్ వాట్ ఈస్ దిస్ మ్యామ్ యాపిల్ కావాలి అని అడుగు గట్టిగా మ్యామ్ యాపిల్ కావాలి తీసుకో వాట్ ఈస్ దిస్ నానా బనానా కమాన్ మ్యామ్ చెప్పు అడుగు banana ivo very good sit properly
So this is the difference after taking therapies. Now she started using, single words and two-word combinations, and she started initiating the conversation. Ma'am, I want this. Mama, banana kawali. Mama, I want this. So she started initiating the speech, and she started choosing the options. So if you want banana, or if you want apple, which one you want? So she started choosing the fruit, and all these has started after sessions. So these are other successful stories, like if you see, the child name is Tejomai. The child was 9 months, but she was not at all crawling, and she was completely on cradle. But after giving sessions, she started supportive walking sideways with the help of furniture. And there are other kids also, where they have a problem with the tone abnormalities, like the child is having increased tone. So because of that, the child could not crawl. But after that, after the sessions, they started walking with push walker, and also independently started walking. So if you see, his name is Arif. So he also, because of some tone abnormalities, he could not walk and he has seizures. But after giving sessions, he started independent standing, not walking, but independently now he is able to stand. And if you see, his name is Manvit. He got operated for inguinal hernia at the early stages. Like, because of that, he could not sit, he could not stand. So if you see the child has severe delay, but after 8 months of sessions, it's not like 1 month or 2 months. We did so much of hard work. So after that, he started walking. So it's all about connection. We have to build the trust with the parents and also with the child. Immediately, if we say to do something in the center or like in our therapy, also he will not follow that. We have to build the connection with the child. We have to build the trust with the child so that the child starts connecting with us and through gentle eye contacts, touch, and gentle routines, we can make the child better. And diagnosis is a lens, but not a limit. What I want to say is we have to diagnose the child. To know the development, like how is the development, we have to know. So diagnosis is very important, but we should not label the child that we have that the child is having autism or the child is having cerebral palsy or whatever developmental delay. We should not label the child. Every child is so unique, and they learn many things, so we cannot label them. So love is the most powerful connection and intervention what we can do to the child. So the therapist role as a soul companion. So it's not an easy task. We have to we have to be with the parent. We have to do parental training programs, and we have to counsel the parent. Why? Because mother is in severe parental stress because of this developmental delays. So this is not a small thing. We have to be with the parent, and instead of giving too many instructions, presence heals more than instructions ever could. So every day, what I think is how can I nurture a child? How can I help the child for today? How can I give a good smile, good pause, and a kind word to the child? This is very, very important. So every child is you meet is a divine appointment. So these are all the special children are always the divine child. So we have to treat them in a proper way. So my carry home message is, for everyone, for every parent. Why? Because early detection is very, very important nowadays. If you see, because of grandparents, I don't know whether I want to say this or not, because as I have seen many cases, parents are very much interested, but the grandparents, what they will do is, no, no, he's not okay. We will wait for 6 more months, or we will wait for 1 more year. Oh, so he will become normal, but he won't become normal. When you are seeing red flag, there is something problem in his brain. So you have to understand that if you are delaying that, definitely you are the problem. So try to understand the condition of the child, and as early as possible, detection is very, very important. Early detection is very, very important. And we should not wait and watch for the development. We have to start intervening. We have to do the home training programs, and also we have to go to the child development center for better progress. And assessment should be done in all areas of development, not only in the speech, not only in the gross motor or fine motor. In all areas we have to completely screen the child, not to label the child, but we have to give the better improvement to the child. This is my motto, and we are working on that in Fernandez. We are just conducting many parental training programs. We are allowing the parents inside. We are conducting the buddy sessions, and we are conducting the programs from the NICU itself. When the baby admitted in NICU, we start counseling the parents. We start counseling the parents and telling the parents these are the developmental patterns. So these are the red flags. You have to be aware of this, and according to that, you have to come to the center. So this is the protocol what we follow in Fernandez Child Development Center. So my colleague, Sreelatha, she speaks. Continue. She continue. Thank you. Sorry, ma'am. Sessions in the sense you are talking about the therapy sessions every day. Awareness program. We are just conducting the awareness programs in our Fernandez hospital only. Like we are going to different places and talking about the parental awareness, why it is very important. Why? Because nowadays autism cases has increased a lot. Not only autism, but there are many developmental delays also, which is very very important for the parent to notice that. So parental awareness is very very important in this generation, according. Yeah, we have the Fernandez ka FB, Instagram. We have that. We post different question and answer sessions, and we talk about the developmental delays, and we do everything in the Fernandez Instagram and FB account.
Good evening, everyone. My name is Sreelatha, and today I will be discussing about how can we prevent the disability. See, we say that prevention is better than cure, right? So we have seen all what are the problems that the child might have in different areas. Now we are going to discuss how can we prevent. So basic changes in our lifestyle, a common awareness that we could think of that, oh, this might be a problem for me or my child in the future. Small bit of awareness that we are going to see today. So today we will be discussing about what are the understanding difficulties and what are the prenatal measures that we can see, and how can we avoid the harmful substances, the importance of genetic counseling, and this early detection, early intervention programs, impact of excessive screening, how can we overcome, and how can the support system for the families, and a message for the mothers. Let's see first what is disability mean. The disability encompasses a wide range of physical, cognitive, sensory and developmental impairment that can impact an individual's ability to perform everyday activities and participate and participate fully in a society. So basically, as Dr. Sandhya has explained, the disability encompasses those five elements where the child would have a difficulty in, just not only one. Let's see the prevalence. The prevalence is very high, where all over the world the disability is being the disability is being recognized, wherein they also have the problem of social, economic and emotional challenges, wherein the persons with disability needs to be taken care. The purpose of presentation is basically where we try to explore the preventive measures all about. The prenatal period. Basically, what is a prenatal period? Prenatal period is basically from the conception to the birth. From the conception to the birth, what are the mother need to take care? Basically, we are trying to prevent, since that the problem might occur from the conception, basically. So basically, the essential nutrients for the fetal development, the mother has to take a proper adequate intake of folic acid, iron, calcium and omega-3 fatty acids, wherein that helps for the bone formation and brain development and cognitive development. The balanced diet and supplement also helps a pregnant woman, where she gets a proper vitamins and minerals, and the impact of malnutrition. We know that the malnutrition also affects the fetus, wherein it is a high risk of having disability in a child. So basically, prenatal preventive measures avoiding harmful substances. Now basically this is all about the lifestyle that we have right in this generation. So basically exposing to alcohol, tobacco, the illicit drugs and few medications that you are not allowed to take during the pregnant, that will also have the high risk of having disability in your child. And the environmental toxins, wherein there are some foods that will have the lead, lead, mercury and few pesticides. or because of all these, the fetus might develop the problems of various disabilities. Basically, you need to create. You need to know now that I will be having a baby. What kind of food I am going to take? What kind of mindset I should have? With that, you can avoid having disability in your child. The guidance and support. Go speak to the counseling experts, go speak to the pediatricians as to what all things that I have to take care, and try to discuss as to what are you going through. And your mental pieces is also equally important during those period. That will affect a lot. I have seen so many parents saying that when we take a history with a parent, they say that yes, ma'am, I was not mentally okay when I was during my prenatal period. I had some trauma. I had some fights in my house or some death in my family. All this will also affect the baby. So basically, we should, in that period of 9 months, we should see that we are mentally peace and physically healthy, and eating right. So basically, this is genetic counseling. Like most of them have no idea that that the genetic counseling is very important. We might have a family history of disabilities that we don't know, and we don't want to bring it up to the doctors. We don't want to even mention it, and that is something that most of them need to know. So genetic counseling helps parents to understand what are their inherited conditions that they may increase their disabilities, wherein the family counseling also helps them. They try to kind of take your family history and then do a little bit of the questions, whatever you answer, they try to take the inputs, and then they try to suggest like what are the things that you need to take care when you conceive, and even after conceive, what are the measures that you could take. Just not the emotional, just not the technical guidance, they would also give your psychological support, which will manage your anxiety. Like your if you have any kind of issues that your fetus is having, they would also discuss that. So basically, early detection, screening and diagnosis. So timely screening, diagnosis, and developmental delays or congenital disabilities allow prompt intervention, which can significantly improve outcomes and quality. So basically, what are the common screening methods that we do in those 9 months are like ultrasound, newborn hearing screening, metabolic test, developmental milestones evaluation, which will help detect abnormalities early in prenatal and postnatal stages. So what are the integrating multidisciplinary assessments that we would do? So basically collaborating with pediatrician, genetist, neurologist and therapist ensures comprehensive evaluation and diagnosis, which will help you to plan appropriately. So early intervention programs, like what are if you take the early intervention, what would be the goals and benefits? So early intervention focuses on providing the therapeutic, educational and support services during critical development windows to enhance functional abilities and reduce the impact of disabilities. Like what are the types of services that are given in an early intervention setups are like, we give speech therapy, occupational therapy. Speech therapy is basically if the child has a speech difficulty, and occupational therapy where the child has a difficulty in motor skills, fine motor skills and gross motor skills. And physical therapy is also kind of where the child is not able to perform the daily activities. And the behavioral support, if the child is showing lot of behaviors. Why does the child show behaviors? It's all because of if the child is not able to perceive things around it. If the child able to not able to understand what we are trying to say, so obviously the child is going to show behaviors. So all this behavior therapy would help. the child to overcome the challenges. The family educational tailored and individual needs. The main aim of the sessions, as Dr. Sandhya expressed, we also train parents. We also discuss a lot with the parents as to what is happening with the child in house, what kind of activities are you planning, and what kind of environment that the child is having. Based on that, we try to give them a home program where they can also work. If the child is not able to come to the sessions on a daily basis, we give them a home program, and we try to we try to evaluate periodically, like 1 month or 1.5 months. We ask the parent to get the information and the improvement what have been done in the house. Yeah, managing screen time in early childhood. So basically, the recommended screen time. The screen time is actually a very big drawback that we have. The parents are not able to manage the children due to their work schedules, or because they don't have a patience to manage the child, because they are excuse me, they are having kids in the late years. Give me a second. What? So basically, this screen time has increased a lot. Just not with the children, even the parents are also busy in using their phones, laptops and TVs. They binge watch series and everything. So the time limit up to 2 to 5 years is just in half an hour. Just a half an hour that the research has approved. The child can watch screen time only for half an hour in a day. How can that screen time should go? Basically, it should go in a with a co-viewing with the parent. Just don't leave the child to watch the screen. Even if you're giving a screen time, sit with the child and also talk to them as to what is happening on the screen, and keep asking questions. Let that screen time be very interactive. So create a screen free zones and times. So set a proper guidelines that the child is not going to have a screen time during eating period and during bedtime. This would also help the child to avoid the risk of having disability, wherein the child sees the screen and then the child is sleeping, and the child is actually watching TV and then eating, but he is not looking at his food. So basically, the child is not aware of what the child is actually eating. He is just gulping and watching the screen. Basically, the child should know, touch, feel, and what the child is eating. So avoiding screen time during food, just not the children, even for the elders, avoiding screen time before sleep and during food time is very, very helpful. So what would be the impact of excessive screen time on development? So basically, the cognitive development and language development would hinder for the child. So cognitive development, where the child is not putting any effort. When the child is watching the screen, the child is not putting any effort as to problem solving, anything. The child would not putting any effort. Instead, you give them some blocks and then they try to build something creatively. Where the child is actually putting his cognitive abilities to do something. So when he is watching something, there is no interaction, there is no challenging. He is just watching. The pictures are moving and he is just watching. So that way, the cognitive and language development will have a problem. Where the physical health concerns, the child will just sit and watch. There is no walking, there is no running. Where even the obesity also might. The small children, the 1 year, 2 year children are also facing the obesity problems these days. So what are the social and emotional effects? Yeah, there is no interaction. There is no interaction in the screen. The people talk, they go, and the screen is also really fast. Whatever they do is really fast, and they cannot comprehend what is happening in the picture. They just like to see colorful lights and the moving pictures. Apart from that, they would not get anything from the screen time. So by which, wherein there is no interaction, their social and emotional aspects would also have problem. So what are the strategies that we can reduce screen time? So basically setting clear boundaries and schedules. So having a proper schedule that what my child would be doing every day. The child will also have a body pattern that this time I'm going to watch, yes, this time I'm going to watch. Suppose that the parent or the caretaker have to plan something for the child. If you're saying no for something, you should tell what the child should be doing. If you just say no, still what is the alternative that the child can do during that time? So you can also plan something wherein there's lot of activities, in-house activities that you can do with the child to engage for removing screen time. And the parental role modeling, parents also should demonstrate the same way. So as we say, you open the book and sit, and child would also open the book and sit. If you sit with a phone and then you ask your child to do some activity, obviously the child would snatch your phone. So that is very basic thing that the parent should also know. So you will be as a role model as to if you do something, and then like how we do pretend play, as a Dr. Sandhya said, you pick up phone and talk, and the child would also do that. If you cook, and the child will also do that. So basically, the parent should also try to minimize the use of the cell phones, wherein the child will also not be exposed to the screen time as much as parent. So empowering mothers for a healthy future. So basically, the holistic approach to disability prevention is combining nutrition, like we are just recapping what we have done is nutrition, avoidance of harmful substances, genetic counseling, and early detection. What are the forms of comprehensive strategies to reduce disability that we have discussed? So the promoting early childhood development is also what we discussed, and the supporting families as partners. So basically, mothers and families, we will have a proper family and parenting networks where they try to exchange what is happening with the child, what is happening with the other child, what is the parent doing, what did it work. They try to exchange the strategies wherein they help each other to get the child in a better way. So this is the end of the presentation. If you have any questions.
So any questions you can ask us, like, related to this?
So basically, we are aiming to bring an awareness, not just with the married or the child, but also to the young girls, wherein they would be becoming mothers down the line 10 years or 5 years, this thing. So the basic awareness as to what kind of disabilities my child have. Supposedly, as a mother, when we have a child and we are not even aware of what is the problem. If the child is not rolling, and then no one is even asking what is it, and we don't even bother. If the child is not able to stand, and the elders say, oh, maybe they'll take some time, and the mother is not aware as to what is the problem. The child is throwing tantrums, and we don't even know what should we do it. Yeah. So with the education, I feel that we should have some awareness programs or in a graduation syllabus, we should have some curriculum that the awareness need to be.
Definitely.
It's very, very important for mothers to understand that they will have some peace of mind. They can't handle children. I also get patients like that, small children. Because when we encourage mother, because they are already in a complex stress. It's a very, very, very complicated condition for them.
I would like to add on this. What you said. The mothers are very stressful. The family should understand that not only the mother, everyone in the
Take
family
part.
has to take part in the intervention. Why? Because nowadays, if you see the mothers who are coming to the therapy, they are very much stressed. So they are just leaving the kid only to the mother. Mother is not only the main part for the therapy. Everyone in the family has to support.
What I'm trying to say, because mother is the closest, to the child.
Okay.
So interaction is mother only that time. So we cannot depend on the whole family. When one person starts, the whole family will follow.
Change. Yeah.
So that is the idea behind
Yes,
it.
definitely.
We start at least one mother or father who is in close contact with the child. So that will be really a magic.
Yes.
Yes, meditation and mindfulness helps a lot.
Meditation really helps, because as the mother will calm down and the things will be easier
Change.
for her to handle, and she will be able to handle so many things then. That is very, very important. So if you guys can incorporate this meditation technique, sister is there,
Yeah.
members are there, they can come weekly or fortnightly to interact with mothers, especially for mothers,
Yeah.
because they have the close contact, they monitor children. So that is what I would.
We will definitely work on that. Why? Because as I have already told to Preeti sister that you please come and visit to our hospital, so that already I have spoken this with Preeti sister. Why? Because parents are really stressed.
Yeah, very
So definitely they need some meditation, techniques to feel
Yes,
life.
yes.
So I have already discussed with Preeti sister. Definitely
Nice.
it will happen very soon.
Thank you.
I have one question. There is some patients are very ferocious. Once they come, they spoil the whole lot. And the parents don't want to tell anything. It's okay. The parents don't tell anything. See, I seen, once one of my neighbor, the boy came. If you press the tree on button, that's how it gets stuck. It will not come out. So we find it really difficult to tell them. I know the system is really embarrassing to tell them. Any solution that can be done for it?
So basically, the boy is full of energy. He doesn't know where to spend it. So when they actually come out, or even in house, they have to spend their energy in some way or the other. So basically, what the parents has to do is they have to put the child. They have to channelize their energy in a proper way.
Divert the mind.
Yeah, no, channelize their energy. It's
Okay.
yeah.
They can take to the parks.
Yeah, there would be some physical act. If you feel that the child is really energetic, you should have some proper physical activity for the child on a daily basis, where the child is spending most of his energy in a proper channelizing way, where his energy is being utilized in a proper way. So that's what we do. If the child is really active, we do lot of physical activities,
Acha, okay.
and then the child would actually calm down.
Actually, for me, like as you said, no, it's fine. No, I don't want recording. Yeah. So what is my thing is that sometimes I am also working, and we are also stressful, right? We cannot work like a machine, right? You don't have to child, you don't have to cook, you don't have to job, and job there are various things are there. So like we are working with computers, so sometimes I'm working with the IT, so I know how many things are there. So due to that, I'm not able to spend more time with my child, and that's the reason maybe my child is more attached to my grandparents than his grandparents. So whenever he won't see him inside a home for half an hour or 1 hour, he will ask continuously to me that when they will come. I said, I'm here for you. You can talk with me, I can play with you, but still he wants them. So this is the one thing I want to reduce with me, that he can feel affection with me as well. Because nowadays we have to earn it for our child only. Like we are not earning for ourselves, we are earning for the needs that we are doing. But he is like having those standards that he only wants them.
How old is he?
He's 3.5 years.
So basically, what I would suggest is, whatever the time you have, utilize that time in a proper way with him. So see, now that, see, we are not a superwoman that we can do all of these things at one, at one go, right? So if you feel that you are really struggling in all these areas, try to see where can I get help. Okay, now that you're struggling with cook, so try to hire one cook and use that cooking time in a proper way to engage with your child. Okay, you keep one cook. You see that, oh, this is the time which I'm not cooking, so I have to put that my energy and my time to my child. Okay, so that too, how you should do, just not sitting with him and talking with him. Try to converse with him, have fun, go out, run, sleep, whatever you do as much as with him. Again, that way you're building connection with him, right? So that is what their grandparents do for him, right?
I understand, but he's like, that's what I want to learn. I want to teach him more emotionally and socially strong. Like if something is not with you, somebody is not with you, like grandparents, but I am here with you, right? You can talk with me, you can play with me. I'm showing him a love as well, but he said, no, no, you just for a while he will be like that, but after that, after some time he will be with me. So like sometimes my his grandparents won't be here every time, right? They also have to do that home job as well. So in this situation, maybe he will keep asking, he will keep crying that when they will come. I don't know what to answer this.
So you should have a proper schedule, ma'am.
In separately.
Yeah.
But I think later on, I think I'll connect with you and once I will bring my child as well for awareness that I want to understand that is my thinking right or is not? Is my thinking not correct as well? And I am also being very, very stressful. I know that is our days, right? How to reduce the stress, I don't know, but that's how our meetings are going on in the evenings.
Understand. But you have to, like, how does the meeting happen? You plan it, right? You plan the meeting in your work and then you do it. I'm asking you, I'm suggesting you to have some plan or some schedule that you can spend your time with the child. Read a small one story, 10-minute story every day before bed. So keep that pattern every day. Oh, this is a story time. So sit with him and then try to just run the book and then talk to him. Keep one schedule that the story time is going to have only 10 minutes in the night. So something like that, wherein you can connect with the child. You can also understand what are his emotions. And when you're reading a story, keep asking questions. What did that person is going to do? What the person, if the person is going to do that way, how are you going to react? If you were in that place, what would you do? Something like that. And you try to build your own stories. If I was like this, I used to do this. Okay. See, if someone is dashing at you, someone is actually hitting at you, what would you do? Maybe you would say, I would also hit back. So then you would also respond saying that, if I would have been in your place, maybe I wouldn't have hit back. And I would ask that person, are you okay? So that way his thinking process will also change, right? Oh, why is he hitting me? Should I really check with him as to what is wrong with him? So yeah, keep some pattern that you can spend some time. So giving the gifts and presents is not important. Your presence is very important for the child. So yeah, no, working parents is very difficult. If you feel that now that the grandparents are not home, have one caretaker at home and you try to train the caretaker as to what are the activities that the child should do. Everything should be in a proper scheduled way, wherein it has to happen like this time should happen, the drawing time, the physical time, the screen time, the food time. However we plan our work, even the child's schedule should also be in a proper way, wherein their body schedule will also imbibe and they also follow. Yeah.
Any questions from
Youngsters.
you have to be more careful, more planned.
I wish I knew this in early my years.
That's the reason I'm saying, see, young girls need to have awareness as to what is the problem and how do we even handle it. Unless you don't know that there's a problem exists, you never know how to handle it, right? You never know why the child is throwing tantrums, why the child is not eating, why my child is not wearing dress, why my child is not ready to wear full sleeves, and my child is not ready to haircut. These are all comes under sensory problems. And he's like, he just doesn't know it. He just doesn't allow us to do haircut. He just doesn't want us to allow us to give head bath. But there is a child is actually going through some sensory problem wherein he is not able to say, right? So all these kind of small awareness, that every girl basically now, so they should have, yeah.
I have also one question. Why you opt this film week as your career on?
For me, there is a reason. Like my cousin brother, he is mentally retarded. So I have been with him. I played with him. So at the age of 16 years, he died. So my childhood was with him. So I thought, okay, it is somewhere connected to me in my mind. So whenever I see special children or whenever I see there is some problem, I just have inside that I just want to work with them. So finally, I got a chance and I studied in this field and I started working with these children.
So my idea of coming to this field was I used to work as a preschool teacher initially. So just for the money, the school used to take the child with a lot of challenges. Like special child they used to take and they used to put in a normal class. Me being as a class teacher, I had no idea how to manage the children. And then I finally, try to research as to what is a child is want. Why is a child not talking to me? Why is a child is sitting at one place? Why is a child is behaving like this? I have no idea. Like as you said, we have no idea what is happening with the child. So with the slow research, I also started, doing lot of, taking workshops, and then finally I did my graduation in with a special children. So that's how I'm in this field.
Thank you so much. And now we will meditate for 3 minutes. We will sit in silence. And let